Right now, the market is open and people are shopping for health care. Kate Keller, the vice president of with Interact for Health, is joining us today to discuss the healthcare exchange. Now, Kate, we've heard some people are having trouble logging onto this system, even in the first place.
That's true. So the exchange is opened on Tuesday, and the amount of traffic they had was sort of unexpected. So just the amount of traffic caused the system to crash. But then even now, since the systems are open and some people are getting through the traffic issue after waiting for a few minutes, they're still having some glitches with some of the drop-down boxes and things. And CMS is aware of it, so they are working on it.
Now, there is some confusion for some people over who can log on to this, who qualifies for that. Can you explain that a little bit?
Sure. So the health insurance exchanges are designed for people who need to purchase their own insurance or for small business owners who need to purchase insurance for their employees. So for people who are self-employed or who are currently uninsured or they work for a business that doesn't offer insurance, this is a place for people to go and shop for insurance and to see the plans, sort of compare them apple to apples and be able to lay them out to make it easier for people to shop versus calling insurance company to insurance company to insurance company.
Right now, other people have some concerns that this might drive up costs for people who are covered through their employer. Is that an accurate assumption?
Well, I guess we don't fully know the impact of this. That's not really expected to happen. The major changes that have happened in the law regarding private insurance has already occurred. So there's not expected to be a big shift for people who have insurance through their employers. If you look for a big company, chances are your insurance isn't going to change much at all. It probably will go up as it does every year, just as the healthcare market gets more expensive every year. But they wouldn't expect to see a major influx in their premiums because of it.
Good information there. Now, if people are having trouble or maybe have questions about the health exchange, who do they talk to? Can they come to you with those questions?
So there are resources in our communities of where you can reach people. Now, if you're in Ohio or Indiana, you have the Federal Exchange, which is healthcare.gov, and they have a chat box. So if you want to do it online, you can click and talk with somebody online. They also have an 800 number you can call and talk to a person. And those people are there. They're not part of the government shutdown, so you should be able to have an interaction with a live human being about it. There are also local resources where you can go to a community health center or things, and they have people who have been licensed in these centers. So you can have somebody walk through the process with you and answer those questions. And also at our organization and on our website, reform.interactforhealth.org, we have all kinds of easy to understand information about the Affordable Care Act, and then you can type in questions there and we'll answer them.
All right, well, Kate, thank you so much for joining us.
Sure.
I hope we got a lot of information out there for people who might be confused about this.